Hey everyone, today I'll be talking about inguinal hernia. Hernia is defined as protrusion of whole or a part of the viscus through a defect or a weakness in the wall that contains it. When this protrusion occurs through the inguinal canal, then it is known as inguinal hernia. To know more about the anatomy of inguinal canal, you can check out my YouTube video on the same, the link for which has been mentioned in the description below. Inguinal hernia can either occur due to congenital causes or can be associated with certain acquired causes, some of which include chronic constipation, straining, obesity, cigarette smoking, lifting of heavy weight, or can be associated with certain urinary causes such as benign prostatic hyperplasia, or can be associated with chronic cough. Inguinal hernia is of two types: indirect inguinal hernia and direct inguinal hernia. The indirect inguinal hernia comes out of abdominal cavity through the deep inguinal ring. It then traverses along the inguinal canal and then becomes superficial through the superficial inguinal ring. The direct inguinal hernia, on the other hand, enters the inguinal canal through a potential area of weakness in the posterior wall of the inguinal canal, and this is known as the Hasselbalch's triangle. The boundaries of Hasselbalch's triangle are as follows. Medially, it is bounded by the lateral border of the rectus muscle. Laterally, it is bounded by the inferior epigastric artery, and below, it is bounded by the inguinal ligament. After this, the direct inguinal hernia also becomes superficial through the superficial inguinal ring. A patient of developing hernia can complain of dragging pain and a swelling in the groin region. Swelling is seen better on coughing. To confirm the diagnosis of inguinal hernia, your doctor can perform certain clinical tests which can include a ZEIMAN'S 3-finger test and a deep ring occlusion test. To know more about these tests, you can check out my YouTube shorts on the same, the link for which has been mentioned in the description below. Diagnosis of inguinal hernia is mostly clinical, but your doctor may advise you to get some investigations done that may be relevant to the precipitating factors. Once the diagnosis of inguinal hernia is established, then its management is mainly based on surgical intervention. So this was all about inguinal hernia in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video, and subscribe to my channel. Thank you.